Hey everyone, today is the 15th. I had my arm lift extended down to the sides around with a breast lift with breast implants under the muscle, then an extended tummy tuck. My scars go from here to here with abdominal muscle repair, and then they did liposuction around the back. I took some updated pictures today that I'll have at the end of this video. So I had my second follow-up on Friday. Today's Saturday. So I guess today the surgery was the 14th. The 4th, so today's the 15th. So this is day 11. I hardly take any Tylenol for pain at all. So when I went yesterday for my follow-up, they took my last 2 drains out, which I was so excited. The first 2 drains that came out right here were pretty painful. The other one, since he had to do liposuction right here on the Mons area, the 2 tubes were coming out right here, and I was just dreading that. They didn't even really hurt at all. So I was like I'm so happy to have all my drains out. I'd say the biggest pain point for me is after taking a shower every day is putting all of these pads and stuff back on. He said I literally have thousands of stitches. So it's putting the paper tape and trying to keep the pads in place while you put all of these compression garments on makes you cuss. But other than that, I'm doing great. I feel great. This is some new compression garments that just got in the mail. I ordered them off of Amazon because I didn't want to have just that black, just black all over. This is my regular pants I was wearing before the surgery, so I had seen some videos where it says you go up like 2 sizes. I haven't. I weighed this morning, and I've been weighing every day, which is a bad habit to do, but I still do it. And I had fluctuated. I think the most I went up was 3 pounds. Today I'm down 4 pounds from my lightest weight from last year. So the swelling's gone down. I am still very swollen, so you'll see in some of the pictures I post after this. I took some good pictures. They took all the steri strips off of me yesterday. He said, because I told him when I shower, I basically just wash my hair and let that run down and wash my arms and my abdomen. I wasn't washing anything else. He said, and I was using Dial soap. He said, don't use Dial soap, it's too harsh. I was like, it's antibacterial. He said, what he wanted me to use is like the cheap bottle of Suave conditioner for your hair. He said, use that on all of your body, on all of this, just kind of lightly, just go over all of your stitches with Suave conditioner. I was like, okay. I will say, I was using Kotex pads for all of my stuff, and I found those they were so bulky, and it's like they made me itch. And so don't get the super absorbent ones because they're too thick. If you can get like a lighter ones, but when they retaped me yesterday, it was so much easier. So I went online to Amazon and I found the Medline AB pads 5x9. Today got them 100 pads for $22. And I found that I'm using probably about 12 pads each time, because I have so many cuts. It literally goes, and you see in the picture, it goes from my elbow all the way down here, around here, up here, and from hip to hip. I will show you you'll see some of the bruising, I think down one of my sides from the lipo, and I think I got a picture around my back from the bruising. It's not that bad. Let's see what else. She talked to me about, so sometimes the nurse at the office had literally just had this done a few months ago herself, so she was really helpful. She said you could start what they call spitting stitches, and she said the most time that happens is underneath the breast, and she said you'll start seeing this white stuff. It may look like it's pusty or infected. She said don't worry. She said start off putting like Neosporin on it for a few days and then use Aquaphor and stuff, and like the stitches will come out. It's like because the stitches are absorbable, but some of them your body will reject and start spitting them out. She said, don't worry about it. It's perfectly fine. I also took a picture of my belly button so you could see that. I was worried one day last week because I looked down and there was this yellow in my belly button. I was like, oh my gosh. So I took a picture and sent it. Is just packing that they had left in there. So I go back next Friday and he'll take the stitches out of my belly button. So he was super excited with how I looked. He said he cannot wait to take my after pictures. I may pull up one of my before pictures so you can see what I look like before. So that'll give you an idea, like the before and after. And I'll take this down so you can see kind of what I'm looking like now. You can't really see. This is all bulky from, so you can see there's some of the pads, and just trying to figure out how to wear this, how far to wear the girdle. I asked them, I was like, how far down do I pull it? And they said, just, to cover where your stitches areas are and stuff. So you can kind of see I'm still swollen, so I still look pretty good. I'm so happy with this, very happy. I asked him, one of the hardest things is, I will say with the breast implants, I was at first, my first visit, I was like kind of disappointed. I'm like, my boobs are smaller than what I started off with. I was a D before I had my surgery. I was a double D before when I was my biggest weight. And so I went back and I'm like, I look like a freaking B cup. I was like, what the hell? But then within that next few days, it's like, bam, they dropped down there. I was like, okay, this is what I'm talking about. So I kind of asked him, in yesterday's visit, I'm like, okay, how do I know what size I'm going to be, what kind of bra I need to buy? And he says, I really need to wait at least a couple more weeks and then measure. He said, but he estimates I'll be at least a double D. I'm like, okay, I'm happy with that. That's what it was. For me, I was like, if I'm paying for implants, I want them to look fake. I don't care about looking natural. I looked natural before. I was like, I want them up, up, kind of rounded up here. So he put in, I think it's the Naturel, it's silicone, SRM, so smooth, round, moderate profile. 310 is what he put in each one. So you can't really, I guess you can tell there. I was like, oh. I'm so happy to get out of that black one that you seen me in the last video. It looked like a big old granny bra. I was trying to unsnap that and wear some regular clothes on. I can, at first they want you to wear button-ups because, with the arm, you can't lift your arm. So I am able to fix my hair, do my makeup. You just gotta be very careful because you can rip this stuff. Because all of this is really numb. It's like even down to here is numb. And it's kind of a weird feeling. It's almost painful numb. But each day I can feel the feelings coming back a little bit more and more. What else? I'd read something about massaging. You're supposed to massage yourself, and the nurse said no. She said that's for when you start developing scar tissue underneath, and that would be later on that I would need to worry about that. You just kind of massage it like that, and it will take a couple of days, to get, you'll feel like the knots under there and stuff. So right now I ain't got to worry about none of that. Everything looks good. I'll post pictures. I feel like Frankenstein, my nephew who's a nurse, I sent him pictures. He's like, Frankenstein. I was like, yeah, I know. But I can't believe how great I feel. I'm getting around great. I don't need my lift recliner anymore. And an idea on that, I was having trouble like calling around to rent lift recliners from like these medical supply stores when they're like so expensive, or you need to buy it. Rent-A-Center, I found one in my local Rent-A-Center. I was able to let me rent it for a month. And they say basically that's what they do. There's a lot of people that have surgery and they rent it for a month, and I think it's like $123 with tax and everything. So that was the best thing, especially for the first week. And right now I think I can deal without it. It's just my regular recliner is so hard to kick the foot down that I'm still using the lift recliner just, to get the feet up and down and stuff. If my other one wasn't so hard to kick down, I would use it. So the pads, the swelling, I'm down 4 pounds from my lowest weight from last year. And I'll tell you, my highest weight before I had my sleeve surgery was 313. I lost 125 pounds, so I got down to 188 last year. And this morning I'm 184. So I'm hoping that it'll go down even more. He was not able to tell me exactly how much weight he cut off of me and stuff. And then if I show you my before pictures, you'll see, I was kind of bulky here, then had a bulky here, and my arms kind of hung down like this. He said he took a lot of skin off of my arms. They look amazing. I really love, they look so skinny, and I'm hoping they go down smaller. He said I only need to wear, this like at least a couple more weeks. And, a lot of the videos I see is like, the longer you wear it, that's shaping your body. And it's like, even this, a couple more weeks. And this also helps with the swelling. It's like, I plan to wear this, at least this kind, a couple more weeks. And then he's like, you can wear like Spanx or something like that to help, anything like that helps keep in shape. I'm like, I spend a lot of money. I'm going to keep wearing me some Spanx for at least a couple of months and stuff. And, helping with the swelling. And it's like, I'm just so happy with the way I look. Not a lot of pain. I wake up kind of stiff in the mornings, but I'm still not able, this looks like I'm standing straight up, and more, I kind of am, but I still catch myself. I kind of got to walk forward because it feels like this is, just pulling so much, which I'm like, yay, great, because it's just so flat and so tight. So I'll keep you updated. I don't think there was anything else that I had for this video. If I think of anything else, and I'll keep posting. I'll try to do it like weekly and maybe go to monthly just to keep you updated. And I've got some pictures so you see what this looks like. I did some research. Even the lady there in his office, and one of my regular doctors who had this done, talks about, you know, for scar therapy, because you don't want it. You can see it kind of in the pictures. You'll see it kind of bulge. You know, some people talk about, you know, just put paper tape. They said if you're going to spend all this money for the surgery, invest in silicone bandage. And there was this one website that I went through the doctor, so I bought one for my breasts. And it's once everything is, you know, healed, you don't have any more scabs or anything. When you start worry about your scars, and it's silicone. They say silicone really works and minimizes your scars. So you start researching that. I bought some off of Amazon, but there was this one's doctor's site that had one for tummy tucks. It'll be long, and you can reuse them for, I think they said up a couple months. So I spent probably $200 to $300 just on silicone stuff. So just to help with the scars. They did tell me that you can't tan. I have a tanning bed. Can't tan for a year, so I started negotiating on that. So they said wait at least 6 months, and then, you know, I got a SPF 100, and it's for your scars. Your scars are darkening up, and I'm like, yeah. So I bought, you know, the SPF one. I haven't been tanning. I'm not going to tan for months. You know, I don't plan on it. I'm going to Disney World the end of November, but so I got to have some kind of base tan so I don't burn. But you know, I plan to use the SPF 100 and cover up and everything on my scars. I don't want my scars dark, you know. So just, I mean, I feel amazing, you know, for all of this. I will say those first 2 or 3 days were rough. Mainly the first day, and the second day wasn't as bad. It was that first day, just because, you know, he had repaired my muscles and my arms were cut, and now the hospital bed only came up so much, and I had to figure out how to set up all the way to sit up on the side of the bed. So you had to use those muscles that had been cut, and it was like, oh my God. So really, it's just that first day. If you get past that first, every day gets easier and better. And today, you know, I'm day 10, and I feel awesome. I'm no pain meds, nothing. I'm putting on my own clothes. I'm showering. I'm wearing normal, regular clothes, and I just feel amazing. So if you have any questions, just comment on here, and I will try to answer. And I'll keep posting videos and updates for you, and I'll post some pictures so you see what I look like. Thank you.